Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about labor and delivery. This is a great video to watch if you're a first-time mom, and if you are a master mom, it is also a great video to watch. Share this video with your birthing partner so they can understand their supporting responsibilities on the big day. Knowing the details of the vital stages of labor will be useful in helping you be better prepared for what to expect. Labor is divided into 3 stages. At the end of this video you will be well informed about what happens during these stages and what you can do to make your labor easier and more comfortable. Also, your birthing partner will understand their support responsibilities. The first stage, this is the longest part of labor and can last up to 20 hours. It begins with the onset of contractions and lasts until the cervix is dilated to 10 centimeters. The second stage starts from full cervical dilation until the delivery of the baby. The third stage, the delivery of the placenta and control of bleeding, which brings to an end the childbirth process. First stage of labor. This stage marks the onset of labor with contractions that cause the cervix to soften and dilate. It involves 3 phases: early labor, active labor, and transition phase. Early labor is the onset of labor with irregular uterine contractions. Active labor phase continue with strong regular rhythmic uterine contractions with cervix from 4 cm dilation until the cervix is dilated to 8 cm. Transition phase continues from 8 cm until the cervix is fully dilated to 10 cm. Each phase is characterized by different emotions and physical challenges. Early labor phase. Several hormonal and physical changes might indicate the start of your labor. Early labor will last approximately about 8 to 12 hours. The cervix starts to efface and dilate, that is, the cervix starts to stretch and thin out. The mucus plug, which has been blocking the cervical passage and protecting the uterus from any infection throughout the pregnancy, is now discharged. Contractions can feel like aching in your lower back, strong menstrual cramps, pressure or tightening in the pelvic area. Contractions are typically mild and somewhat irregular but become progressively stronger and more frequent. It will start in an irregular pattern and last for 30 to 60 seconds, coming every 5 to 20 minutes. Once the gap between 2 consecutive contractions reaches 5 minutes, it means the labor is established. Your cervix will efface and dilate to 4 centimeters. As the cervix begins to dilate, you will notice a slight pink or bloody discharge from the vagina. Lower back pain, loose bowel movements, and pressure in the pelvic area among other symptoms during this phase. Your water might break at any time during this first stage. If your water breaks at this stage and you are at home, note the color, the odor, and the time rupture occurred. This phase can last for hours or even days. What to do at this phase? Call your midwife or doctor to know what to do. Distract yourself by watching television or playing games. Try to sleep by changing positions. Sitting with the knees open and hips at more than a 90-degree angle. Standing forward lean. Semi-reclined position leaning backward can help to relieve pain and give you comfort. Drink enough fluids, a few glasses of water or juice. You may take painkillers such as Tylenol if needed. Active labor phase. Now is time for you to head to the hospital or birthing center. Your contractions will be stronger, longer and closer together. They occur every 3 to 5 minutes and last for about 60 seconds. Your water will break with a gush of fluid, if it hasn't broken in the early labor phase yet, and this speeds up contractions. It is very important that you have plenty of support. It is also a good time to start your breathing techniques and try a few relaxation exercises between contractions. You should switch positions often during this time. You might want to try walking or taking a warm bath. Continue to drink plenty of water to keep hydrated and urinate periodically. Active labor lasts about 3 to 5 hours. If this is your first baby, or if you have an epidural, labor could last longer. Your cervix will dilate from 4 centimeters to 8 centimeters. Contractions during this phase will last about 45 to 60 seconds with 3 to 5 minutes rest in between. Contractions will feel stronger and longer. This is when you can have epidural administered if you opt for it. Birthing partner responsibilities. Give the mother your undivided attention. Offer her verbal reassurance and encouragement. Massage her abdomen and lower back. Keep track of the contractions. If she is being monitored, find out how the machine works. Go through the breathing techniques with her. Help make her comfortable. Prop pillows. Get her water. Remind her to change positions frequently. Go with her on a walk or offer her a bath. Provide distractions from labor such as music, reading a book or playing a simple card game. Don't think that there is something wrong if she is not responding to you. If you are liking this video, please subscribe to support me to post more interesting, educative and informative videos. Like the video, so YouTube can recommend it to others. Share with families and friends so the knowledge can be passed on. Click the notification bell icon, so you can instantly receive any updates right on your YouTube home page of your smartphone or smart devices. Transition labor phase. During this phase, you will rely heavily on your birthing partner. This is the most challenging phase, but it is also the shortest. Try to think one contraction at a time. This may be hard to do if the contractions are very close together. Remember how far you have already come, and when you feel an urge to push, tell your midwife and listen to her instructions to avoid severe tear to your cervix and perineum. Transition labor phase lasts about 30 minutes to 2 hours. Your cervix will fully dilate from 8 centimeters to 10 centimeters. Contractions during this phase will last about 60 to 90 seconds with a 30 seconds to 2-minute rest in between. Contractions during this phase are long, strong, intense, and can overlap. This is the hardest phase but also the shortest. You might experience hot flashes, chills, nausea, vomiting or gas. If your baby descends earlier, you will feel the urge to push before you are fully dilated. If your baby descends later, you will reach full dilation without feeling pressure. Birthing partner responsibilities. Offer lots of encouragement and praise. Avoid small talk. Continue breathing with her. Help guide her through her contractions with encouragement. Encourage her to relax between contractions. Don't think that there is something wrong if she seems to be angry. It is a normal part of the transition. Second stage of labor. The second stage of labor is when your baby moves through the birth canal. The second stage of labor begins when the cervix is completely dilated, 10 centimeters open, and ends with the birth of your baby. Contractions push the baby down the birth canal, and you may feel intense pressure, similar to an urge to have a bowel movement. The second stage of labor, which is the pushing phase, your midwife or doctor may ask you to push with each contraction. The contractions continue to be strong, but they may spread out a bit and give you time to rest. The length of the second stage depends on whether or not you've given birth before and how many times, and the position and size of the baby. The intensity at the end of the first stage of labor will continue into this pushing phase. You may be irritable during a contraction and alternate between wanting to be touched and talked to, and wanting to be left alone. It isn't unusual for a woman to grunt or moan when the contractions reach their peak. The second stage can last from 20 minutes to 2 hours. Contractions will last about 45 to 90 seconds at intervals of 3 to 5 minutes of rest in between. You will have a strong natural urge to push. You will feel strong pressure at your rectum. You are likely to have a minor bowel or urination accident. Your baby's head will eventually become visible. You will feel a burning, stinging sensation during crowning. During crowning, you will be told by your midwife or doctor not to push. Get into a pushing position that uses gravity to your advantage. Push when you feel the urge. Relax your pelvic floor and anal area. Kegel exercise can help. Rest between contractions to help regain your strength. Use all your energy to push. Do not become discouraged if your baby's head emerges and then slips back into the vagina. This process can take 2 steps forward and 1 step back. Birthing partner responsibilities. Help her to relax and be as comfortable as possible. Give her ice chips if available and provide physical support in her position. Encourage, encourage, encourage. Help guide her through her contractions. Give verbal encouragement by telling her how well she is doing. Don't be offended if she displays anger or becomes emotional. What your baby is doing during second stage of labor. While you are experiencing labor, your baby is taking certain steps to enter this world. 1. Your baby's head will turn to one side and the chin will automatically rest on the chest so that the back of the head can lead the way. 2. Once you are fully dilated, your baby's head leads the way and the head and torso begin to turn to face your back as they enter your vagina. 3. Your baby's head will begin to emerge or crown through the vaginal opening. 4. Once your baby's head is out, the head and shoulders will again turn to face your side, allowing your baby to easily slip out. Delivery and what to expect. Keep in mind that your baby has been soaking in a sac of amniotic fluid for 9 months. Here's what happens once your baby hits the atmosphere. Your baby needs to be dried off with a towel and kept warm. Your midwife or doctor may quickly suction your baby's mouth and nasal passages if your baby seems to have a lot of mucus. If there are no complications, your baby will be lifted onto your bare belly so you can identify, touch, kiss, and simply marvel at your baby. The skin-to-skin contact will keep your baby nice and toasty, and your baby will be covered with a warm blanket and perhaps given first hack to prevent heat loss. Your midwife will clamp the umbilical cord in 2 places and then cut between the 2 clamps, or your partner can do the honors, if you desire. Following the contractions and passage through your very narrow birth canal, your baby will display the following characteristics: cone-shaped head, vernix coating, a cheesy substance that coats the fetus in the uterus, puffy eyes, lanugo, fine downy hair that covers the shoulders, back, forehead, and temple, enlarged genitals. You may feel a wide range of emotions at this point. Emotions such euphoria, awe, pride, disbelief, excitement, and of course intense relief that it's all over. Exhausted as you may be, you'll also probably feel a burst of energy, and any thoughts of sleep will vanish for the time being. Third stage of labor. The third stage of labor is when your uterus continues to contract to push out the placenta. After birth, after your baby's birth. The placenta usually delivers about 5 to 15 minutes after the baby arrives. After the delivery of your baby, your midwife or doctor will be looking for small contractions to begin again. The contractions signal that your placenta is separating from the uterine wall and is ready to be delivered. Pressure may be applied by massage to your uterus and the umbilical cord may be gently pulled. The result will be the delivery of your placenta, also referred to as the afterbirth. You might experience some severe shaking and shivering after your placenta is delivered. This is a common symptom and not a cause for concern. After you give birth, here is what happens. After completing all the stages of childbirth, you will be monitored for the next few hours to make sure that the uterus continues to contract and that bleeding is controlled and is not excessive. Most babies are ready to nurse within a short period after birth. Others wait a little longer. If you are planning to breastfeed, go ahead and nurse as soon as possible after your baby is born. Nursing right after birth will help your uterus to contract and will decrease the amount of bleeding. You may receive more oxytocin or other treatments. If you're not going to nurse or your uterus isn't firm, you'll be given oxytocin to help it contract. Many birthing centers routinely give it to all women at this point. If you're bleeding excessively, you'll be treated for that as well. If you tore or had an episiotomy, you'll get an injection of a local anesthetic before being sutured. You may want to hold your newborn while you're getting stitches. This can be a great distraction. If you're feeling too shaky, ask your birthing partner to sit by your side and hold your new arrival while you look your baby. If you had an epidural, an anesthesiologist or nurse anesthetist will come by and remove the catheter from your back. This takes just a second and doesn't hurt. You should now be able to relax and enjoy your little bundle of joy. I hope you find this helpful. Please subscribe for more educative and informative videos. Please share to help spread the knowledge. Please like, so that YouTube can recommend this video. Please turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.